Hi, welcome to Nursing Notes and Knowledge. I'm glad you stopped by today. Nursing students, imagine your patient suddenly develops confusion, muscle weakness, and even dangerous heart rhythm changes. Could it be hypercalcemia? Today we're breaking down everything you need to know about this electrolyte imbalance, from the definition and causes to the must-know signs, symptoms, intervention, and nursing priorities. If you're preparing for nursing school exams or the NCLEX, this video will make hypercalcemia easy to understand and remember. So let's get started. Your in-depth resource on hypercalcemia for nursing students. This presentation provides a thorough understanding of hypercalcemia, covering its causes, symptoms, diagnosis, treatment, and nursing care in clinical practice. We will cover the definition, lab findings, common causes, recognizing signs and symptoms, and we will go over treatment and nursing interventions. Before we dive into hypercalcemia, I want to do a quick review of just understanding calcium and its role in the body. Calcium is a mineral with functions closely related to those of phosphorus and magnesium. Calcium is an ion having two positive charges that exist in the body in a bound form as well as in an ionized or unbound free form. Ionized calcium is present in the blood and other extracellular fluid as free calcium. Free calcium is the active form and must be kept within a narrow range in the extracellular fluid. The body functions best when blood calcium levels are maintained between 9.0 and 10.5 milligrams per deciliter. Calcium is important for maintaining bone strength and density, activating enzymes, skeletal and cardiac muscle contraction, controlling nerve impulse transmission, and is involved with blood clotting. Calcium is found in both extracellular and intracellular fluids. However, it is more concentrated in the extracellular fluid compartment. The normal serum calcium concentration range is 9.0 to 10.5 milligrams per dl. 30% of calcium is absorbed from food. However, vitamin D is needed for calcium absorption from the GI tract. It's important to know that the ion phosphorus inhibits calcium absorption. Therefore, the actions of these two ions on the body have an opposite physiologic effect. Both calcium and phosphorus are stored in the bones and are excreted by the kidneys. Hypercalcemia is defined as a high level of calcium in the blood, generally above 10.5 milligrams per dl. Small increases above normal levels have severe effects, so early detection is critical. Calcium plays a vital role in bone health, muscle contraction, nerve transmission, blood clotting, and cellular signaling. Maintaining proper calcium levels is crucial for these physiological processes. How is calcium regulated? Calcium homeostasis is regulated by the parathyroid hormone, vitamin D, and calcitonin. These factors control calcium absorption, excretion, and storage to maintain balance. Calcium enters the body by dietary intake and absorption through the intestinal tract. Dairy products are common foods high in calcium. Absorption of dietary calcium requires the active form of vitamin D. Calcium is stored in the bones, and when more calcium is needed, the parathyroid hormone is released from the parathyroid glands, which then increases serum calcium levels. This next slide illustrates functions of parathyroid hormone and calcitonin. So calcium balance. The parathyroid glands secrete parathyroid hormone, or PTH, which is responsible for the regulation of calcium ions in the bodily fluid. The parathyroid glands are located on the posterior thyroid gland itself. When serum calcium levels are low, the parathyroid glands secrete more PTH, which increases the calcium level by promoting calcium release from the bones as needed. This diagram shows PTH is released from the parathyroid gland. PTH increases serum calcium levels by releasing free calcium from bone storage sites, stimulating vitamin D activation to help increase intestinal absorption of dietary calcium. It inhibits calcium excretion and stimulates kidney calcium reabsorption. Conversely, when there's an excess of calcium present in the plasma, PTH secretion is inhibited, and the secretion of thyrocalcitonin, TCT, a hormone secreted by the thyroid gland, is increased. TCT causes the plasma calcium level to decrease by inhibiting bone reabsorption of calcium, inhibiting vitamin D associated intestinal uptake of calcium, and lastly, increasing kidney secretion of calcium in the urine. All of these homeostatic mechanisms help to either increase or decrease serum calcium levels. TCT is also called calcitonin. When calcium levels in the blood get a little too high or elevated, calcitonin is released. Its main function or job is to lower the amount of calcium in the blood. Next, we explore frequent causes of hypercalcemia, associated risk factors to help nursing students recognize underlying conditions that contribute to elevated calcium levels. The main cause is primary hyperthyroidism, which is caused by excessive secretion of parathyroid hormone, leading to elevated calcium levels. Excess parathyroid hormone increases calcium absorption, which causes hypercalcemia in the bloodstream. There are certain cancers that can cause hypercalcemia through bone metastases or secretion of parathyroid hormone-related protein. With cancer-induced hypercalcemia, some cancers increase calcium levels by spreading to bones and release parathyroid hormone-related protein. Some cancers promote the secretion of the parathyroid hormone and may be referred to as tumor-secreting ectopic PTH production. The most common types of cancer that cause hypercalcemia are breast, ovary, and prostate cancers, as well as leukemia and gastrointestinal cancers. Early recognition of malignancy related to hypercalcemia is crucial. There are additional causes of hypercalcemia, and these include medications like thiazide diuretics, vitamin D toxicity, and chronic conditions like sarcoidosis, calcium loss from the bones, or bone loss because of malignancy or prolonged immobilization can also elevate calcium levels. All of these conditions or scenarios highlight the need for a thorough patient intake and patient history. Recognizing signs and symptoms of hypercalcemia. In this next part, we'll focus on identifying clinical manifestations of hypercalcemia, ranging from mild to severe symptoms with their associated complications. Keep in mind, patients may present with nonspecific complications. Manifestations of hypercalcemia are related to its severity and how quickly the imbalance occurred. For example, a patient with a mild but rapidly occurring calcium excess has more severe problems than a patient whose imbalance is severe but it developed slowly. Signs and symptoms include the following. Intestinal changes are first reflected as decreased peristalsis. The patient may exhibit constipation, anorexia, nausea, vomiting, abdominal distension, and pain. Bowel sounds tend to be hypoactive or absent. Patients may be confused, lethargic, and exhibit fatigue. Patients will have muscle weakness, decreased deep tendon reflexes, and cardiovascular changes are the most serious and life-threatening problem of hypercalcemia. Mild signs and symptoms, a patient may present with increased heart rate and blood pressure. Severe or prolonged calcium imbalance depresses electrical conduction, slowing the heart rate. On an EKG, look for bradycardia. Also look for signs of decreased or diminished ST segment and shortened QT interval. Also observe for indications of poor tissue blood flow or tissue perfusion, such as cyanosis and pallor. Advanced signs and symptoms include confusion, arrhythmias, and polyuria. For cardiac symptoms, assess EKG for dysrhythmias, particularly shortened QT interval. Assess for blood clots. In terms of renal, patients may present with renal abnormalities such as polyuria. This is a common symptom in advanced hypercalcemia. Patients may present with flank pain, calcium stone formation in the kidneys. Severe hypercalcemia can lead to life-threatening complications such as cardiac arrest and renal failure, making rapid recognition and intervention critical. Timely diagnosis and emergency treatment are essential to prevent fatal outcomes in hypercalcemia. Diagnosis and laboratory findings. Essential lab tests help determine the cause and severity of hypercalcemia. Assess serum calcium, parathyroid hormone, and vitamin D levels. Obtain serum calcium levels to assess calcium balance and identify abnormalities and trends. Measure parathyroid hormone levels to determine parathyroid function. And lastly, assess vitamin D to evaluate for deficiency or excess. Interpreting diagnostic imaging, imaging studies like bone scans and CAT scans can identify malignancies or bone involvement contributing to hypercalcemia, guiding the patient treatment plan. Bone scans help detect bone involvement and bone abnormalities related to malignancies that can cause hypercalcemia. CT scans provide detailed cross-sectional images to identify tumors or metastases that can also contribute to hypercalcemia. Treatment modalities and nursing interventions for hypercalcemia focus on reducing serum calcium levels through various interventions. These include IV hydration, diuretics to increase calcium excretion, and biphosphonates to inhibit bone reabsorption. IV hydration helps dilute blood calcium levels and promote renal calcium excretion. IV normal saline 0.9% sodium chloride is usually given because sodium increases kidney excretion of calcium. IV solutions containing calcium, for example, Ringer's lactate or LR, are stopped. Use of diuretics increase calcium excretion by the kidneys. Specifically, loop diuretics, for example, furosemide or Lasix, are used to lower calcium levels as this medication enhances the secretion of calcium in urinary output. Calcium chelators, also known as calcium binders, help lower serum calcium levels, and biphosphonate inhibits bone reabsorption, reducing the release of calcium into the bloodstream, essentially inhibiting calcium reabsorption from the bone. This next slide has a side-by-side comparison for both disorders for calcium, hypocalcemia and hypercalcemia, for your reference. The table includes common causes for each disorder, signs and symptoms, and treatment modalities. Feel free to take a screenshot so you have this as a study reference. Patient education and discharge planning. Educating patients on medication adherence, dietary modifications, symptom recognition, and follow-up is essential for preventing reoccurrence and complications. Educate patients about the importance of following medication schedules. Inform patients about necessary dietary changes to support recovery and maintain health. Teach patients to identify warning signs and symptoms of hypercalcemia that require prompt medical attention, and stress the importance of scheduled follow-up appointments to monitor progress and prevent future complications. Understanding hypercalcemia is vital for nursing students to provide effective care. Comprehensive knowledge of its causes, symptoms, diagnosis, and treatment ensures better patient outcomes. And that wraps up our deep dive into hypercalcemia, one of the key electrolyte imbalances every nursing student must master. Remember, hypercalcemia occurs when serum calcium levels rise above normal, and it can show up with classic signs like muscle weakness, fatigue, kidney stones, confusion, and even life-threatening dysrhythmias. Nursing priorities always center around monitoring cardiac status, ensuring patient safety, encouraging hydration, and implementing treatments such as IV fluids, diuretics, or medications that lower calcium levels. If you're studying for the NCLEX or preparing for nursing school exams, be sure to connect this content with real-life clinical scenarios. Think about how you would assess, intervene, and educate your patient. That critical thinking piece is what helps you not just memorize the facts, but actually apply them in practice. And if you found this video helpful, don't forget to hit the like button, subscribe to the channel, and turn on notifications so you never miss new content on electrolyte imbalance and nursing interventions. Your support helps this channel grow and keeps free nursing education available for students like you all over the world. Thank you so much for watching, and remember, every video you study brings you one step closer to being the confident, safe, and successful nurse you're working hard to become. Until next time, keep watching, keep pushing forward, and we'll see you in the next one.